Alright guys, what's up? It's Dr. Dan. We got Nora in the house. Nora is how old?
7 years old.
7 years old. And Nora's been a long time chiropractic patient. She is been here since no brothers and sisters, right?
Yes.
And now you have
2, 3.
3 of you guys, and a 4th one on the way. You guys are going to see Mom get adjusted in a little bit. I think Mom's 30 weeks pregnant or somewhere around there.
35, I think.
35. And a wonderful family that's been coming in for a number of years. You'll hear Megan's story after we finish up with Nora here. But Nora is 7 years old. She's been getting chiropractic care since she was just a little baby girl. Now she's a big sister, right?
Yes.
Big sister to 2 and almost to 3. But today you guys will see how we adjust a 7-year-old. And Nora was out of care for a while. The family was busy. And so they just started back a little more frequent, probably 2 or 3 months ago. And Nora's got a little bit of lymph node swelling over on the right side of her neck, which you feel how that feels right there on the right. She's got a few little lymph nodes, a little bit of congestion up in the right side neck. So today we'll talk about how chiropractic care, how muscle work, how the hypervolt helps to ultimately drain lymph nodes, reduce neck tension, which all of us get no matter our age. We could be 2 years old and strain our neck, or we could be 30 years old and strain our neck. So Nora has a little bit of right side cervical spine. Is that tender right there a little bit? A little bit of neck irritation, a little bit of inflammation, which we're going to just loosen up. You've had the hypervolt before? Feels good? We're going to do level 2 on the hypervolt. Right there's level 2. And we're just going to loosen up Nora's upper back just a little bit. For kids, the hypervolt is an awesome tool to help reduce muscle tension, as well as desensitize children to the feeling of touch. The feeling of touch with the hypervolt can be useful when children or adults are sick with any kind of chest congestion, mucus production, lung inflammation or irritation. Really good to use the vibration effect to help break up mucus and congestion that develops in the lungs, in the bronchioles, down in the trachea. Just go ahead and look down for me, kiddo. And kids, Nora's had a couple ear infections, you think? 1 or 2? Zero ear infections. Awesome. Mom says 0 from the back. 0 ear infections. One of the things that we want to work on in children, if you do have frequent ear infections, is reduction in tension up in the neck, up in the cervical spine. Good. So a lot of times if kids are getting frequent ear infections, they're placed on antibiotics and ultimately tubes in the ears. You good? And some chiropractic care, some stretching, some muscle therapy can help us big time to help drain lymphatic congestion, swollen lymph nodes out of the head, out of the neck. All right, let's go face down for a minute. They have the same bones, the same muscles, the same pieces that an adult has. Let's put arms down gently. And Nora knows, as we've worked with her for a while, how we educate kids on sitting positions, how we want Nora to do her homework at home, sitting down in the rocker, how to stretch her back out a little bit mindfully throughout the day. Go ahead, take a deep breath in for me. and exhale out. And what we're doing, guys, is just checking this upper thoracic spine. She's a little rotated right through here, and a little bit of tension right in the mid-back right through here. So we're feeling for just vertebrae misalignments that can create, you feel that right there, that little knot? And so we're going to do some thoracic, some lumbar, and some cervical adjustments on little Nora. Go ahead, take a deep breath in for me, kid. And she's been through this before. Exhale down, little baby bit. 1, 2. Go ahead, breath in for me. And exhale down for me a little bit. Nice job. One more in. Exhale down for me. Good. And one more time, deep breath in. And exhale down. Perfect. One more in. And exhale down gently. All right. So we got 4 regions in the thoracic spine to move nicely. Down here in the sacrum, when we do work with parents with children, we always educate on correct sitting posture, trying to really focus on that little rocker position, the go-to rocker, the toes down and in, the heels up and out. And that helps us to stretch the hips and to reduce muscle tension in the pelvis. Adjustments also in the low back and the pelvis will help Nora to maintain good structural alignment, good bony alignment. Mindfulness in movement is something we want to create, mindfulness in our sitting postures. So usually when kids are right around 3, 4, 5, is this sore over here a little bit? Yay or nay? Yeah, a little bit. She shook her head, yes. Face over to the window, right side up. Hips just a little bit of the tighter side. You good? Bottom leg straight. Like this, nice. Taylor has shoes like this as well, little sparkly shoes. And nice.
Natives.
What's that?
Natives.
Natives. Okay, breath in, exhale out, whole way out. Relax here. 1, 2, good. Other side. Side will go a little easier. Breath in, 1. Breath out, whole way out. Good. Nice job. No pain. So when kids get adjusted or used to adjustments, it's really easy for them to jump up on the table. They know what to expect. They get nice and comfortable and relaxed in their adjustments. For the most part, for most kids, we get really good relief of neck pain, mid-back, low back pain, right with just a couple weeks. A couple adjustments can help balance the skeleton out. Sometimes more frequent visits are necessary, depending on how structurally imbalanced they are. All right, kid. Let's go. Palms right here. And shoulders open, nice. Now we're going to do left side, real easy. Relax your shoulders for me. Let's go one more time there. And one more time on the right, gentle. Nice. Now one more time on the left. There we go. Okay, guys. You guys can see how Nora's laying nice and straight. Feet are straight. Hands are nice and relaxed right here. Nora, when you go to bed at night, it's good to practice just laying flat on your back like this, closing your eyes, trying to breathe nice and comfortably, trying to feel how your feet are nice and balanced, your arms are nice and balanced. Is that cool? Sit up tall for me. Spin this way to the right. Good job. How you feeling?
Good.
Good. So we know Nora's been in here the past 2 or 3 weeks for, this week we saw her twice because she did have a little strain, a little irritation up in the right neck. We also educated Mom, look down for me, on how to just softly kind of massage out some of the right side neck swelling, which she's got a few lymph nodes over here that we want to just help to drain, we want to help to stimulate, we want to loosen up the muscle and the connective tissue so that we're not always kind of like squeezing up into the neck. Working on children is super important to, again, just kind of like desensitize them to some of the chiropractic work, some of the hands-on work. Also get them comfortable with a little bit of pressure, a little bit of tension up in the neck so that they can effectively heal a little bit quicker and we can, you know, just prevent ongoing growth imbalances, structural imbalances throughout the skeleton. Kids are active, right? They jump, they run. What's your favorite thing to do?
Run.
Run, swim too a little bit. Cool. You guys play outside a bunch? Do you have a trampoline or no trampoline?
Trampoline.
You have a
A
trampoline?
little one.
Little one? No big one yet though? No. So the little trampolines, a little safer than the big trampolines, but you know how active kids are. They're just out there, they're running, they're playing, they slip, they fall. So many times kids kink or irritate or sprain or strain their cervical spine, their low back, their mid back. Many of us grow up to be adults with injuries that we carried around from the time that we were children. And so getting checked by a chiropractor initially is important, and then, you know, regular follow-up care throughout adolescence, teenage years can definitely help to eliminate a lot of the aches and the pains and the stuff that grows with us to adulthood. And we're going to follow up with Nora in probably another 2 or 3 weeks, see how her neck's doing. Get her another adjustment to loosen up the mid-back, the cervical spine, the lumbar spine, and then the right foot. All right, kiddo? Good work today. We'll see you guys later on future appointments.